It's Tuesday, October 1st, and this is the Daily Medical News by MD Edge, where we bring you the top clinical medicine headlines and a closer look at the day's biggest story. I'm Nick Andrews.
And I'm Molly Calagio. Today, universal screening for autism spectrum disorder is possible, but the current tools are lacking.
Canagliflozin is the first drug approved to treat diabetic kidney disease in 20 years.
Before you prescribe allopurinol, find out if your patient has heart disease.
And NICUs are admitting more normal weight babies.
Plus, an early-stage breast cancer diagnosis increases the risk for atrial fibrillation.
When it comes to screening for autism spectrum disorder, there are conflicting recommendations and imperfect tools. New research published in Pediatrics analyzed the performance of one common ASD screening tool, the Modified Checklist for Autism in Toddlers with Follow-up, known as MCHAT-F. Looking at more than 25,000 children aged between 16 and 26 months who were screened at Children's Hospital of Philadelphia, the MCHAT-F had a sensitivity of 39% and a specificity of 95%. The positive predictive value was 15%, while the negative predictive value was 99%. The screening tool had worse performance among younger children, minority children, and children from lower-income households. The less-than-ideal performance of the MCHAT-F comes against a backdrop of conflicting screening recommendations in ASD. The American Academy of Pediatrics recommends universal screening for children 18 to 24 months aimed at earlier identification and diagnosis. The U.S. Preventive Services Task Force, on the other hand, says there is insufficient evidence to recommend universal screening.
For the first time in 2 decades, there's a new treatment for diabetic kidney disease. The Food and Drug Administration approved canagliflozin, marketed as Invokana, for the treatment of diabetic kidney disease. It is now also indicated for the reduction of hospitalization risk due to heart failure in patients with type 2 diabetes and diabetic kidney disease. The approval is based on positive results from the Phase 3 Credence trial. In that study, patients with type 2 diabetes and chronic diabetic kidney disease received either 100 milligrams of canagliflozin or placebo. Patients who received canagliflozin saw a 30% drop in the risk of the study's primary composite endpoint, which included end-stage kidney disease, doubling of serum creatinine, and renal or cardiovascular death. Patients on canagliflozin also saw a reduction in the risk of secondary outcomes, including a 39% drop in the risk of hospitalization for heart failure. Common adverse events associated with the drug included female genital mycotic infections, urinary tract infection, and increased urination. Serious adverse events include ketoacidosis, kidney problems, serious urinary tract infections, hypoglycemia, necrotizing fasciitis, serious allergic reactions, and bone fractures.
Are you considering prescribing allopurinol? First, find out whether your patient has heart disease. That's the message from researchers at Mass Gen who evaluated known associations between heart disease and severe cutaneous adverse reactions to allopurinol. The researchers used an administrative database in British Columbia in Canada to study patients started on allopurinol. They excluded anyone with a history of severe cutaneous adverse reactions before starting the drug. The researchers published their findings in the Canadian Medical Association Journal. Of the more than 130,000 allopurinol users that were identified, 109 were hospitalized for severe cutaneous adverse reactions associated with the drug. The risk for hospitalization was significantly elevated in patients who had heart disease compared with those who did not. Other factors that were significantly associated with hospital admission included chronic kidney disease and an initial allopurinol dose of greater than 100 milligrams per day. The researchers said physicians who prescribe allopurinol should look for these risk factors so that they may consider initiating the drug at a lower dose. We'll be right back with the Daily Medical News after this.
There's a shift going on in neonatal intensive care units across the United States. In 2017, nearly half of the newborns admitted to NICUs were of normal birth weight. That's according to a new report from the Dartmouth Institute for Health Policy and Clinical Practice. The proportion of NICU admissions involving normal weight newborns increased from 42% in 2007 to 48% in 2017. At the same time, admissions of very low birth weight babies fell from 16% to 13%. It's all part of a larger shift in NICU care, the researchers said. There's been a big expansion in the number of NICU beds and the number of neonatologists, while the number of newborns has remained relatively stable. This has translated to an increasing number of lower-risk newborns being cared for in NICUs. But do the changes result in better care? Not necessarily. The researchers also found that increases in NICU and neonatologist supply did not always match up with the places with the greatest needs. Areas of the country with high rates of newborn prematurity or corresponding risk factors do not have higher supplies of NICU beds or neonatologists, they reported.
Women with early-stage breast cancer also face an elevated risk for atrial fibrillation, both short and long-term. Those are the findings from a large retrospective Canadian cohort study that included women with stage 1, 2, and 3 breast cancer diagnoses. The researchers matched breast cancer patients 1 to 3 with cancer-free controls. At 10 years after diagnosis, breast cancer patients had a small but significant increase in atrial fibrillation incidence relative to the cancer-free controls. That risk was elevated when researchers looked at specific time periods. For instance, breast cancer survivors had an increased atrial fibrillation risk in year 1 post-diagnosis, with a hazard ratio of greater than 2. After 5 post-diagnosis, the risk was also elevated with a hazard ratio of 1.2. The risk was not higher in years 2 through 5, however. Among the patients with breast cancer, receiving chemotherapy increased the risk of atrial fibrillation. However, the risk was not specifically tied to receipt of anthracyclines or trastuzumab versus other chemotherapy. Risk was not elevated for patients who received radiation therapy. The researchers stressed that the absolute risk of atrial fibrillation is small, so the finding does not warrant routine surveillance. However, they said it should prompt consideration of atrial fibrillation in the differential diagnosis for women with compatible symptoms. These data appear in JAMA Network Open. And that's it for the Daily Medical News. Remember, you can find us on Apple Podcasts, Google Podcasts, Spotify, YouTube, and wherever podcasts are found. For MD Edge, I'm Nick Andrews.
And I'm Molly Collegio. Thanks for listening.